Hello. Today I'd like to talk a little bit about gum disease. Gum disease is something which is often overlooked or neglected when it comes to overall dental care. Maintaining healthy gums is as important as maintaining healthy teeth. If you look at this X-ray over here, what the gum disease is doing is it's causing bone loss. The bone that's holding your teeth in place is receding. This lower line shows where the bone should be, and this upper line is showing where the bone is receded to. So, what causes this bone loss, this gum disease? Number one cause is improper or lack of oral hygiene. It's important to brush properly, but it's also essential to floss and floss properly. And I'm showing this short video which demonstrates the proper way of flossing. Okay, I'm placing the floss between the teeth and I'm using it like a sawing motion back and forth. So the floss goes in between the teeth. And I'm curving the floss around the tooth like this and I'm dragging it under the gums. So I'm mechanically removing all the bacteria that's building up on the root surface and around the gums. And then we curve it around the adjacent tooth and then again drag it down under the gums and go up and down. I'm mechanically scraping off all the bacteria on the roots of the adjacent tooth. Other causes of gum disease is genetics and also some health conditions play a part into this, especially diabetes. Most often we see that people with uncontrolled blood sugar levels do develop gum disease. Also, what's been shown now that untreated gum disease also aggravates other health issues like heart health, brain function, and diabetes. So how do we detect this? Because most times gum disease is without symptoms. Sometimes there may be some bleeding from the gums or some swelling that may show up. The way we check for it is when we do a clinical exam, if you can see in this video here, we check for pocket depth. And in this case, it's showing about 5 to 6 millimeters of pocket depth that you have, which represents the amount of bone loss. Also, what we do is we do a AI analysis, and in this case, it's picking up about 19% bone loss in this case. So how do we treat this? Most often the treatment for this is deep scaling and curettage. That's a procedure where we use specialized instruments like you can see in this video. We go under the gums, we remove infected gum tissue, we remove tartar, and do what is called the root planing. We scrape on the root surfaces to make the root surfaces smooth again so the gums can stick back to the tooth. I hope this brings some clarity as to what gum disease is, what its causes are, and why it's important to manage it. The most important thing is prevention, which means proper brushing, proper flossing, getting a scaling done at least every 6 months, maintaining a good healthy lifestyle, especially managing your blood sugar levels and exercising. Thank you.